Every year, more than 500,000 Americans experience a first heart attack, joining the 26 million already at risk. Many are prescribed a daily aspirin to prevent recurrent heart attacks, but some patients don't tolerate daily aspirin use. Dr. Lori Mosca is a cardiologist and researcher, and she joins us live to talk about a new FDA-approved drug for these patients who don't always tolerate aspirin. Good morning to you, doctor.
Good morning. Thanks for having me.
Thanks for joining us. Let's talk a little bit about heart disease and why it continues to be such a big problem in the United States, some of the latest guidelines that are out, and kind of advice that can help people maybe stop these recurrent strokes or heart attacks.
Yeah, well, you know, it's interesting that the healthy choices are often not the easy choices, right? So even though we have great guidelines and great evidence now about how to prevent heart disease, we really still need to work a lot on making better choices both for our lifestyle and adhering to the recommendations that our physicians give to us.
I want to address the aspirin thing because that sort of seems like it's the gold standard in what we hear for preventing heart attacks for someone who's at risk or had a heart attack, that daily aspirin. Is that true that it's the gold standard currently still?
Oh yes. Yeah, no, for decades now we've known that aspirin can prevent recurrent heart problems. You know, it's really at the top of the list for longevity, for best practices to prevent heart disease. You know, the challenge with it, of course, is that there's side effects associated with aspirin. So we know that about 1 in 4 patients who should be taking it are actually not taking it. And that can increase their risk as much as 300% for a recurrent heart problem.
So 2 questions for you. Is the reason that it's so good, does it kind of thin out the blood and help it pump and circulate a little better? And 2, why are they discontinuing usage?
Right, so aspirin has several properties that are good for the heart. As you mentioned, it can make our blood a little less sticky, our blood cells, so that can prevent clotting, and which can lead to a heart attack. Also has anti-inflammatory properties. So these are the good parts of aspirin. But the downside to aspirin is it can affect the stomach lining in a way that makes us more susceptible to gastritis, to GI bleeding, and that's one of the big reasons why patients stop taking their aspirin.
So what's something that we can do, whether you're a patient or a healthcare provider? I mean, when you think of stomach issues, immediately your mind goes to an antacid. Is that something that helps?
Right. Well, so you brought up a very important point. When you have this problem, it's very important that you don't just try to take care of it yourself, that you talk to your doctor about it, because it could be something very serious, like an ulcer in your stomach. So we want everybody that has symptoms to definitely talk to their healthcare providers. But if you're taking aspirin to prevent a recurrent heart problem, and you're over the age of 55, for example, or have other risk factors for ulcers, I think it's very important that you talk to your doctor about a preventive therapy. And you mentioned at the top that there's a new FDA drug available, and this is very exciting for our field because it's the first time that we really have in one pill the ability to protect the heart through aspirin and also to protect the stomach lining against ulcers. And that's great news because, as we said, one of the big reasons why patients stop taking aspirin is the stomach side effects. And again, stopping it, if you have a problem with GI symptoms and you're not taking your aspirin, your risk for a heart attack could be increased as much as 7-fold or 700%. So this is a real problem for patients with heart disease. Is
the drug that you're talking about something we can ask for by name? Is it available right now? And does it then eliminate your need for aspirin?
No, it doesn't eliminate the need for aspirin. What it is, it's called Yosprala, and it's a pill that combines an enteric-coated aspirin and an agent that protects the stomach lining. So that protective gastric component is released first. Then by the time the enteric-coated aspirin is released, the stomach is protected. So it's been shown to have a reduced incidence of developing ulcers and increased level of adherence for patients. So symptoms are better and ulcers are less. And what we're trying to do here is really optimize the beneficial effects of aspirin therapy without the concomitant risk that's associated with it. So it's kind of a win-win.
So where can people go to find out more about this drug?
Yes, I think, first of all, for general heart information prevention, I would recommend the American Heart Association website. And for more product-specific information, your viewers can go to aralez, ARALEZ.com.
Wonderful. Thanks for joining us, Dr. Mosca.
You're welcome. Thank you for having me.